Good morning, everyone. My name is Maya Luria with TMC for Seniors, and I am thrilled that this month we get to talk about sleep. I know this has been a huge topic for everyone, and it's very popular. We've got lots of talks coming up with our focus this month. And today I have with me our pharmacists from TMC. I want to welcome Eric Bergstrom and Raveena Brar. Eric is there's Eric there. He's off screen. Raveena is going to start us off on the presentation, and Eric is there in case there are additional questions as well to answer. But we wanted to talk about the effects of medication on sleep and sort of the good, the bad, and the ugly today. And so I think this is a great topic. I know that we always get lots of questions regarding our medications. So I want to welcome you, Raveena. Thank you for being here today.
Yeah, thank you for having us.
So I'll let you go ahead and you can jump right into your presentation.
Perfect. So I want to thank everyone for tuning in today. As Maya kindly said, my name is Raveena Brar. I am one of the pharmacist residents here at Tucson Medical Center. And in the room I have with myself, Dr. Bergstrom. You will wave once again, just so you know he's here. And we're going to go ahead and get started we're going to talk about today's sleep, the good, the bad, and the ugly. So to get started, let's talk about some statistics. It's actually estimated that anywhere from 50 to 70 million adults in the United States alone report having trouble sleeping. Additionally, 37.9% of the adults in the United States fall asleep during the day, meaning they don't mean to, but they may be tired, not getting enough sleep at night, so they end up taking daytime naps, the nap cycle. Additionally, 35.3% of adults report receiving less than 7 hours of sleep a night. And last but not least, it's reported that there are higher rates of insomnia or an inability to sleep seen in middle-aged and older adults. So now the question, why do we need sleep? Something I want you guys to think about. Go ahead and save all questions, answers till the end if possible. But this is something I just want you to keep in the back of your mind. So why do we need sleep? Well, sleep actually allows for our mind and bodies to recharge. You can kind of think of it as a newborn, right? So newborns, what do? They eat, cry, poop, and they sleep. So with that, it's because their bodies are growing at a rapid rate. To kind of go along with that, by sleeping, our bodies our bodies do regulate sleep in the same way that they regulate other things like eating, drinking, even breathing. So a lack of sleep can actually take a very big toll on different parts of our lives. In simple terms, sleep is critical for our health. And then the question, well, what happens if we don't get enough sleep? Without the proper amount of sleep, our brains actually can't function properly. And this can lead to a lot of different things, from impaired ability to concentrate to think clearly. In fact, a lack of sleep has been linked to many different things, including car accidents. It's actually reported that a lot of the fatalities, up to 2,000 a year, are due just because of lack of sleep. Relationship troubles, poor job performance, memory problems, mood disorders, and even some systemic medical issues like high blood pressure. Then the million-dollar question, how much sleep do we actually need? Unfortunately, we do not have a million-dollar answer because it does depend. So on the screen, you'll notice there's a nice little table that kind of outlines how much sleep is recommended. What you may note is it does depend by age group. Of course, there's a lot of different factors like stress levels, other things going on. But in general, the older we get, the less sleep we need. And I would say that in adults, it's usually recommended to get at least 7 to 9 hours of sleep. So then we think about it of like, okay, you have someone who says, I can't sleep. What exactly does that mean? Well, there's different phases of sleeping. We have phase 1, which is the onset of sleep, and then we have phase 2, which is maintenance of sleep. Those probably mean nothing at first, but in simple terms, phase 1 basically means being able to fall asleep. This is the fact of you lay down in bed, within 20 minutes, you're able to close your eyes and fall asleep. Phase 2, on the other hand, is maintenance of sleep. And what this encompasses is not only you're able to fall asleep, but actually remaining asleep throughout the night. And the reason I bring up these two different phases is because it's very important to distinguish, okay, if there is a sleep issue, is it not falling asleep, so phase 1, or is it being up throughout the middle of the night, which is phase 2? And depending on what's going on, we can kind of target to see, okay, what can we fix to fix the situation essentially? To be noted, whereas some individuals have difficulty in phase 1, which is falling asleep, and others have difficulty in phase 2, which is staying asleep, there are certain individuals who actually can experience a little bit of issues in both. So they may not be able to fall asleep quickly, and then they are what we call light sleepers, or they're on certain medications that keep them up at night, which we'll get into in a later slide. But it can be a little bit of both as well. So, what are the reasons as to why we're having trouble sleeping? In general, there's a million and one reasons, but the first one we're going to talk about is situational. When I think of situational, the best way to put it is worry-based. Now, I know I call it worry-based, but it can also be excitement-based. These are things that, how they say, keep you up at night. So it can be you're either worried or excited, personal issues, family things, financial situations, job, you might have a big test at school, and essentially any major life events. Next, we have medical-based reasons. And these, from head to toe, it could be something neurologic, psychiatric, or mental. It could be related to heart health. So actually just going back a little, sorry. For mental and neurologic, I would think of something like seizures, anxiety, depression, bipolar disorder. So these are things that can alter your sleep. Then moving down to our heart, you have heart health. So for example, if someone has congestive heart failure, what we have is they have a lot more fluid in their body than their body can handle. So when they lay down, essentially they're unable to breathe properly because their heart's not working effectively. Then we have things like respiratory system. And this, you can't breathe, it's hard to sleep. It could be asthma, allergies, it could be COPD, sleep apnea. So all those things, basically something with the lung system. Next, we have GI related. And for this, it can be acid reflux. So just think of really bad heartburn, but usually comes with a diagnosis of an actual acid reflux, or even just bad heartburn in general. The urinary system, this one I think a lot of us know when you wake up and you're really comfortable and you have to go to the bathroom. So that one's on there as well. And last but not least, pain, any type of pain. It could be new onset pain, or it could be something kind of acute hurting. And then we move on to environmental. So when I think of environmental, I think of our main senses, or our 5 senses in general. So first you have lighting. Now, I know a lot of people like to sleep in the dark. I personally like blackout curtains, no light, but some people actually need a night light to get that onset of sleep. So as I said, depending upon which phase you're struggling with, lighting can be very different. Noises. Some people like to sleep with absolutely nothing, complete silence, and that's what works best for them. And some others, like myself, when there's nothing, I hear every creak, every motion. I hear my neighbors. So it just kind of depends what's your personal preference. Unpleasant odors. This can be body odors. Maybe your partner worked out, didn't take a shower before bed. Maybe you didn't take the trash out. Maybe there's mold. And then sleeping next to a partner, children, or pets. The best way I could think of this is kicking, snoring, your pet taking up the entire bed. So this is what we call environmental. And then let's move on to the medications. So a couple things I do want to know. It's important to always know the onset, which is how long it takes for your medication to start working, and duration of how long it's actually going to work anytime you have a medication. And As always, please talk to your doctor or pharmacist before starting any new medication or making changes to your current regimen. So, which medications can alter our sleep? There's quite a few. First, the group is taking stimulating or insomnia-inducing medications at bedtime. So, of course, we have certain medications which you'll get a warning, or you should get a warning when you pick them up from your pharmacy. But just to quickly go over, so some antidepressants like Prozac, Zoloft, bupropion can actually cause you to be a lot more awake. So it's best to take those in the morning if you are, I guess it would vary if your sleep schedule is kind of the opposite, but you would take them at the opposite end of when you're going to bed. So if you sleep at night, you would take them in the morning. Steroids. So a lot of them end in "-zone". We have prednisone, prednisolone, dexamethasone. So a lot of your zones. And for these, they actually can be very stimulating as well. So you want to take those usually in the morning or earlier in the day. We have psychostimulants. This includes things like Adderall. To be noted, even some weight loss pills actually fall into the psychostimulant category, like phentermine. So make sure that those, if you are taking them, which once again should be talked about with your pharmacist or physician, take them in the morning. Decongestants. This is one of the ones you can walk in, you're congested, purchase some Sudafed. It actually can be very stimulating, and it's something that can cause some insomnia at bedtime. Nicotine replacement therapies. These as well, sometimes it's best to take them off prior to bed. They also can cause nightmares. So if you're experiencing nightmares, maybe take it off a few hours before bed. And lastly, B vitamins. B vitamins are known as the energy vitamins a lot of times, and for some people, they can be stimulating as well. Then we move on to the opposite. So taking sedating medications during the daytime and actually having naps during the day, which end up affecting your sleep at night. So things like benzodiazepines, which usually end in PAM. You have lorazepam, alprazolam. You probably know them by names like Xanax, Ativan, Valium, things like that, which can be used for a multitude of situations from seizures to anxiety. These can sometimes be more sedating and alter your sleep at night. Allergy medications. So I know a lot of times we say things like Zyrtec and Claritin are not sedating, but for some people they are. In fact, my mom, when she takes Claritin, she's very sedated. So we have those. It's best to kind of figure out how your body reacts, as well as Benadryl, which is very sedating. And then lastly, pain medications. Although I understand we can't control pain without medications in certain situations, it's best to kind of keep it in mind that it may alter your sleep at night. Then we move on to the bathroom-inducing medications. So these are things like your diuretics. With these, you have Lasix or furosemide, hydrochlorothiazide, etc. These are the medications that you're going to pee out the water in simple terms. And the closer you take it to bed, the more you'll be up in the middle of the night. So when we talked about duration and onset for something like Lasix, for example, one of the things is best way to remember is for Lasix, usually you will be up and about and urinating for at least 6 hours. So these, unless of course you do need them at bedtime, should be taken in the morning. Bowel movement stimulants, so Dopalax, suppositories. You have a little bit of constipation, you can go into the store, purchase these. Keep in mind that they can, if taken at bedtime, they will keep you up. And then lastly, some other side effects. So we have beta blockers, which actually can alter the melatonin production in your system, and these end in lull and sometimes cause insomnia. And then ACE inhibitors, which end in pril, and this like lisinopril, and they can sometimes cause cough, which can keep you up or your partner. Herbals and foods. So these are the ones where you can go into your local CVS, Walgreens, pick them up and walk out. But it's something to keep in mind. Bitter oranges, black and green tea, coffee, chocolate, kola nut, energy drinks, and ginseng. These can all keep you up as well. So now that we've kind of covered what causes insomnia and trouble sleeping, the main question becomes, how do we actually address it? And for that, there's two different methods. We have non-pharmacological and pharmacological. I think a lot of times people think, okay, well, as a pharmacist, your first option is going to be to recommend me some ZQuil or some medication. And it's actually not true. As a pharmacist, our jobs are to ensure you are being treated appropriately, whether it's with medications or without medications. So for all patients, we always recommend, first and foremost, addressing the problem and trying to go about things without medication. As a wise person once told me, everything has a side effect, whether it's a medication, whether it's a food. So if possible, let's try and correct the actual situation at hand before adding on medications. So some non-pharmacological methods. First, prioritize sleep. It's important to keep a consistent routine. You want to give yourself some time before bed to wind down, usually about 30 minutes. It does vary person to person. In that time frame, do your normal routine, get into bed, sometimes journaling, listening to some meditating music, or whatever works best for you. Don't force sleep. If you note you're laying there for at least 20, 30 minutes and you are not falling asleep, sometimes it's best to get up, do something for 30 minutes or so, and then come back and try again. Note for that, get up and do something. Usually it's best to do something kind of physical. Maybe do some yoga, etc. It's best not to pick up our phones or watch TV because that can actually add to the problem. And then having a fixed wake up time. This can be very difficult, but it's part of building a routine. If you can wake up on time, it becomes easier to sleep on time. Then we move on to our 5 senses, or creating a comfortable sleep environment. So light control. As I said, some people need a nightlight. Some, like myself, need complete pitch blackness. So whatever works for you, kind of incorporating that to try and make it as comfortable as possible. If you have a problem with complete silence, maybe some white noise, as well as possibly calming scents. So for example, lavender is actually known to kind of calm us down. A lot of time, lotions for like bedtime, even baby lotions for bedtime, will have that lavender incorporated in it. Very importantly, unplug from electronics. It's very easy, I'm very guilty of it, to lay mindlessly in bed and just scroll through your social media, your emails, texting family and friends. But it's that blue light can actually alter our sleep schedule. So it's best to kind of unplug and turn them off. And as well as exercising daily, get your body moving. As well as, it's actually very important to address the stressors and worries. So we kind of covered what can cause people to stay up at night. And one of them was stressors and worries. So for that, journaling, meditation, maybe talking to a therapist. But it's important to figure out if there's something going on that's quote unquote keeping you up at night, can it be addressed? And if so, how? Additionally, if you note that you're having some difficulty sleeping because of possible underlying medical concerns, sleep apnea, restless leg syndrome, pain, anything going on, it's important to talk to your doctor. The same applies if you have a spouse or a loved one, whoever is sleeping next to you. If they, for example, are snoring very loudly, it's something that they should probably get checked out as well. Then moving on, you want to ensure that you're following tips to avoid any nighttime exacerbations of certain conditions. What that means is there's certain things that we can do to kind of make other situations smaller, kind of a confusing sentence, but let me give you some examples. So for example, if you have congestive heart failure or acid reflux, which is GERD, well, it's a little more of a pronounced acid reflux, but positioning your head higher when you lay down, so that way you're not just laying flat. And it keeps the fluids and the acids from kind of hitting your throat and letting you breathe a little better. If you also have acid reflux, sometimes sleeping on your left side, and this helps because gravity is your friend in that situation, and it keeps the acid at bay. If you have severe allergies, maybe removing the carpet could be another option. You also want to be mindful of the foods that you're consuming. So you want to avoid eating too close to bedtime, avoid spicy foods if they're not tolerated as well, or if you have a medical condition that should warrant not having spicy foods, as well as discontinuing or reducing the usage of alcohol, caffeine, and nicotine. If possible, you want to also avoid taking medications close to your bedtime that disrupt your sleep. This is something we talked about a few slides ago with, for example, your diuretics or your bathroom medications. Now we're going to move on to the pharmacological methods. Couple things though. We want to ensure pharmacological methods are only used after trying non-pharmacological methods, and they should only be used for a very short period of time. It should also be noted that sedation and drowsiness are actually usually side effects of medications and not necessarily the drug's primary indication. Meaning, these medications that you see on the screen, the fact that they work for sleep is usually not why they're prescribed or why they were made for the most part. It's just sleep happens to be a side effect, similar to how some medications, like an ACE for high blood pressure, cause cough. These medications cause drowsiness. So once again, please talk to your doctor or pharmacist before ever starting a new medication. And the first medication that we're going to go through are antidepressants. Perfect. So as we kind of stated earlier, some antidepressants are very stimulating, so your Prozacs, your Zolofts, but some are actually more so sedating, so trazodone, mirtazapine, doxepin. And these medications can be taken at bedtime, and they will kind of help with falling asleep. To be noted, they're actually very useful in patients who also suffer from depression, anxiety, substance abuse, etc. So those are our antidepressants. Next, we have a class of medications which we kind of group together. They're called the benzodiazepines and non-benzodiazepines. Benzodiazepines we covered a couple slides ago, but these are your Ativans, your Xanax, and so on. And then your non-benzos are like Ambien, Lunesta, Sonata. These are probably the commercials a lot of us see on TV. And they act very similarly in our bodies. We kind of lump them together. But to be noted, they are controlled substances. And with that, they're associated with a risk for dependence, as well as if you do take these medications, drowsiness can carry over into the morning. And last but not least, for the non-benzos, specifically Ambien, what's been found is some people have unusual sleepwalking-like behavior. I actually had a patient once who reported getting in his car and driving and having no recollection of it. These are things to be noted. Then we have Belsomra. This is another sleep medication. It just acts on a different receptor in our bodies. But once again, it is a controlled substance, and it's associated, has a risk for dependence. Drowsiness can also carry over into the morning. One thing to know about Belsomra is it's a newer medication in comparison to some of the others, and it's actually only available as a brand name, so it can be a little expensive. Moving on to our over-the-counter medications. So one thing to know is you should not be using over-the-counter medications for more than 10 days without talking to your physician or pharmacist, especially something like Benadryl, ZQuil, and Unisom. Reason being is they can cause dizziness, headache, constipation, blurred vision, and increased risk of falls, especially the older we get, the more pronounced these symptoms are. Then we have melatonin. So melatonin is generally a naturally occurring hormone in our body, but research shows that it is safe if used for approximately 3 months or so. The one thing to note with something like melatonin is since it's a dietary supplement, it's actually not regulated in the same way a lot of our drugs are. It kind of bypasses and goes through a different route, so it's not as, I guess, the potency and purity are not something that are closely watched by the FDA. Then we have our herbals that can help with sleep. Before I go through these, I just want to note that evidence is very lacking many times for herbals, and they're not regulated by the FDA similar to melatonin, but they do interact with a lot of other medications. So if you ever do consider taking any of these, please talk to your doctor or pharmacist before doing so. We have valerian, German chamomile, and kava kava. So in summary, sleep is critical for our mind, body, and overall health. Not receiving enough sleep can lead to an impaired ability to concentrate or think clearly. On average, we should be receiving anywhere from 7 to 8 hours of sleep. Note with averages, it can be less, it could be a little more, but generally that's where we try to hit it. And things like our environment, situations, medical related issues, and medications can all have an effect on how we're sleeping. But if you do find that you're unable to sleep, the biggest thing is let's find the root cause of the problem. Let's not just put a band-aid over it. Let's try and figure out what's going on so we can properly address it. As we covered, there are many non-pharmacological ways to increase the amount and quality of sleep we're getting. And as always, please talk to your doctor or pharmacist before starting any new medications. Thank you, and now we'll open the floor to questions.
So thank you, Raveena. I do have a couple of questions that I wanted to ask. That was a lot of information. It was great information to have, so we appreciate that. So I wanted to find out a little bit more about, folks who often turn to sleep aids to fall asleep. And obviously we know that that's quite popular, whether it's a Tylenol PM or melatonin. So in the long run, does that make your insomnia worse if you're continually taking those types of medications at night to fall asleep?
Yeah, so one thing a lot of individuals don't realize is something like Tylenol PM, that PM ingredient is actually usually Benadryl that's added in. And with Benadryl, it actually can cause some dependence as well. So what we find is the longer they're on it, harder it is going to be to take off. One thing I should have added is if you are on any medication, you should be weaned off by your doctor or pharmacist.
Okay. And what about melatonin? Because I know that with melatonin, I know you mentioned that you shouldn't really take it for more than 3 months. Is there something specific that if you're going to the store and you were going to try melatonin that you should be looking for in the brand that you purchase? And is there an amount that people should, it's recommended that they take? And I don't know if that's dependent on weight or not. But what could you give us a little bit more information? I know melatonin has been so popular.
Yeah, definitely. So anytime it comes to a vitamin or a supplement, the best advice we have is to go with brands that you know of. So unfortunately, as we said, these medications, they are medications, are not monitored by the FDA. So by picking brands that are well known, it kind of helps feel more comfortable. That's something as an outpatient pharmacist I always recommended. I mean, as far as dosage, I think Eric will go in.
Hi, good morning to everyone. Hopefully nobody fell asleep. I didn't fall asleep. It's very, very engaging. So thank you all for tuning into this. So as far as dosing, I feel like 3 to 5 milligrams, like 30 to 60 minutes before going to bed. This is, like she said, a natural hormone in your body. And this starts increasing when the lights start going down. So when it's summertime and the daylight is longer and there's less light around or more light around, it's going to like maybe push your sleep kind of further back. And then as you get to wintertime, it's kind of pushing it forward. So that's why she said like some of the things like getting ready for bed, like start taking yourself off the electronic devices, because the light is what keeps the melatonin from going up. And so normally, like when you have like melatonin is probably best when you're jet lagged, when you're kind of changing environments and stuff like that. It really just tries to get the melatonin levels up so that you're getting ready to go to sleep. So again, if you can do it by just changing your routine for bed, like turning the lights down, creating that environment before bed, your melatonin levels are going to go up. So then that way you don't have to waste your time buying and money, buying medications. Because I always think, I see people like, well, if it doesn't hurt you, but it also can hurt the pocketbook, some of the melatonin is relatively cheap and it comes in gummies as well. So this is something too, I've had patients where my wife's hairdresser, her granddaughter got into her purse and got into her gummies, and her gummies were melatonin gummies. And so the child ate a bunch of gummies thinking they were candy, and these are melatonin. And so, sometimes the dosage forms we pick make it fun to take, but it also appeals to kids. So again, keeping your drugs and medications out of the reach of kids, I think, is another really good plug. The other thing too, I want to say about like reliability of medications, like Raveena said, we have an FDA that really looks at kind of the prescription and more of the OTC type meds, but there's a USP verified site or stamp that goes on like over-the-counter meds that it's like the Better Business Bureau of medications. So it tests the tablet. So if you take a tablet and they say, oh, there's this much, banana in it. Well, it doesn't have to have that much, but this test and see that the tablet breaks down, that it has that much banana or whatever the medication is in there. So USP verified is something I would look for on some of the OTC products, even some of the aspirins and stuff like that too that you get. Like, and we can maybe even include that if you wanted to send out to people who are listening.
And that's on vitamins too, right? The USP. Okay, so that's something I know that is, might be important for folks to start looking for when they are purchasing maybe their vitamins when they're in the store. And I guess my last question for you would be, if somebody's is on some different medications, you would suggest that they go and visit their pharmacist to maybe do a reconciliation and look at maybe the timing, it sounds like, of when they should be taking these medications and just really doing a reconciliation of all of their meds together, correct?
Right. I've had patients who talk to their friends at Dunkin' Donuts and they compare medications and they one of my patients said, oh, I'm on 10 milligrams, you're only on 5. And so the guy increased it. But this guy had liver failure. And so because of our organs and how they process our medications, it's really important that, our doses might be adjusted based on our organ function. So you don't listen to your friends and other people that might tell you talk to your doctor, talk to your pharmacist. We can kind of ask you about your renal, your kidney function, your liver function. And one of the things too to note, it's kind of interesting that you might be on a medication for a long, long time. As you get older, your organs start not working as well. It's just like anything, like your car. Like you've got a car and you keep driving it, even though you take care of it, it still doesn't work probably as well it was like 20 years ago. And so if you're on the same medication as you were on 20 years ago, you might even need lower doses because it's might be accumulating in your body, and maybe the accumulation is leading to some of the side effects. And some of the side effects might be sleep during the day. It might be staying up at night. So I think too, is talk to somebody who knows something about what conditions you have and what other meds you're on. When you go to pharmacies, sometimes if you go shopping around, they don't always know your full med list and interactions. So there's just so much to just understanding the big picture that, even the OTCs and herbal supplements, so they can really look at everything. And it takes a while, and it's really important to do. So
yes, and I know, Eric, your team has done a fabulous job in the past over here at TMC for Seniors in doing a med reconciliation individually with folks. And so it is important, and we hope to be able to do that again in the future when it's safe to do so. But you should definitely reach out to your pharmacist and bring your entire list with you when you are doing that, just to make sure that everything is, you've got a proper reconciliation. So thank you so much. Those are all the questions that I have for today. So I want to thank Eric and Raveena for being here. This was fabulous information. I will send it out to anyone who had registered for the class if you are interested in reviewing that PowerPoint as well, because you did have so much in there. So thank you all for being here. We will see you for our next presentation. We do have one on Thursday, and that is Train Your Brain to Sleep with Jill Jones. We'll look forward to seeing you then, and that will be on Thursday at 10 a.m. Thank you all.